Paul Roberts here at the KLOTHO conference at UCI's Beal Applied Innovation Center with a real live functional medicine doctor. Dr. Bita, welcome.
Hello, thank you for having me here. It's a great couple of days learning, great presentation, amazing doctors.
Like you. So you're going to tell us what is a functional medicine doctor?
So basically, we're looking at the root cause of the disease instead of just prescribing drugs. For example, if you come to me with high blood pressure and are on medication, I won't just sit and prescribe you a drug. I'll put you on a detox. I'll change your lifestyle. I'll look at the root cause. Is your mercury level high? That can be one of the root causes.
So that takes more than 5 minutes, so I'm used to it's an oil change. I come in, I tell you I need my oil change. They check my blood pressure, they give me a pill, they give me a procedure, and I'm out the door. You're saying it's more than that?
Absolutely. I take at least 30 minutes with my patients
Wow.
to get the history, and then I put them, as you said, oil change, I put them on a cleanse for 2 weeks or 3 weeks, depending on how much patient is willing to do. Believe it or not, it's hard for patient to give their coffee up or give them...
Oh, yeah, because as much as we complain about the current state of medicine, we do kind of like that I can just go in, I'm there for 5 minutes, you give me a pill, and I think everything's cured. So it's more holistic than that. You're looking at the whole person here, and you spend more time than a few minutes. I like that. Where's your practice based?
In San Clemente.
San Clemente, okay, so right here in Orange County. All right, all of that's great, and we could talk forever about the problems with modern medicine and the alternatives like functional medicine, like doctors like yourself that have a whole different approach to this. Why are you here at a scientific conference talking about KLOTHO, K-L-O-T-H-O? Go look it up. This amazing protein that people have been working on for 20 plus years, and this room is filled with people who think it might be a way to fight cancer, to help recover from serious brain injuries, to grow hair. It seems like every organ of the body might benefit from this amazing protein. What did you hope to learn by coming here?
Yeah, it's amazing. I will add KLOTHO into my practice.
Really?
I,
okay.
believe it or not, had no clue a few months ago before I met Dr. Sewell, who actually was one of the amazing presenter. And
we interviewed him earlier. He's doing gene therapy and some other things here.
Exactly. So it's amazing add-on to my practice. As we get older, our KLOTHO level drops, but it depends on the lifestyle too. I learned so many new things. If you eat processed food, fast food, if your phosphorus level is high,
I was amazed by that.
KLOTHO level will be lower. If you exercise, healthy lifestyle, eating KLOTHO benefit foods, supplements, it can all elevate.
And who knew what I don't know what my KLOTHO level is. I go in to get a blood test, to get a battery of tests once a year, my physical. Nobody's ever asked me, what's your KLOTHO level? How old are you? Is your KLOTHO level dropping off? Are you going to get more likely to get dementia and disease and other things? And what can we do to boost your KLOTHO level? Exercise or injections or other sorts of things. Stimulate.
The body.
Nobody ever asked me anything about this mysterious protein, and you didn't either.
I didn't even know about it, so I'm lucky to be here, and my patients are lucky.
That's really, your patients are lucky.
Yeah,
well, we're lucky to have you come by and talk to you. What's the one takeaway you got other than there's something amazing and I'm going to incorporate it? Anything in particular? Lots of talks today about the potential for KLOTHO, about the research being done into KLOTHO, about companies being created to take advantage of this research. What struck you off the top of your head? It's not over yet. We still got another half a day to go here.
Yeah, but the phosphorus level, how, diet and stuff affects our KLOTHO.
Nobody ever talked about my phosphates, how much, and somebody said, well, it's like fertilizer. Well, they use phosphates for it. They put it into fertilizer to grow things. Maybe it's growing cancer. I never thought, I went home and told my family that one.
Another thing I thought it was fascinating, how cancer patient or people with chronic diseases like Alzheimer, ALS, they have lower level of KLOTHO.
Yeah.
Basically KLOTHO is protective.
That was an unseen factor in all this, maybe a major factor in all this. Well, I've learned a lot. Sounds like you have too. How do they reach you if they want to extend this knowledge and come visit you and get a whole functional medicine approach?
If they just Google Dr. Bita, B-I-T-A, San Clemente, I will come up. I'm local, 20 minutes from Irvine.
All right. Well, we hope you'll come back and tell us how some of this KLOTHO works on your patients as you integrate it into your holistic approach here. Paul Roberts, UCI's Beal Applied Innovation Center at the KLOTHO Conference.